The COVID-19 pandemic tested the limits of San Diego's healthcare system. To date, it has claimed 6,653 lives.
This was a generational, once-in-a-lifetime event.
In March 2020, Dr. Juan Tovar was working in the emergency room at Scripps Mercy Hospital, Chula Vista.
So nothing that we could have done would have been able to prepare us 100% for it. But I'd like to think that we were as prepared as we could be.
Hospitals had to improvise fast.
We started treating patients out of rooms that were not supposed to be treatment rooms, but we had to because we needed the space. So we created examination rooms out of cubbies. We treated patients outside. We set up 2 tents, we set up a trailer.
But the strain wasn't just logistical, it was emotional.
We saw patients' family members looking through windows at their family members dying. We had to hold their hands as they're dying because they were alone.
That trauma led Scripps and other hospitals to create peer support groups to help staff cope. Tovar's emergency room colleague, Dr. James Cunningham, says that uncertainty in the early days made the crisis even harder.
I think the most challenging part was the unknown and the anticipation. So we started to prepare as best we could, getting ready, expecting that tidal wave of patients.
Instead of a sudden surge, Cunningham says it was more of a slow rising tide of critically ill patients.
We didn't realize as well that people would get sick but stay sick for weeks. And most of the time a hospital is set up to take care of somebody in an acute illness for a few days.
Adding to the pressure, San Diego hospitals weren't just treating local patients.
In Baja California, there's over 400,000 American citizens who live there. And so a lot of those people cross the border to seek care here.
Dr. Ghazala Sharif is Scripps' chief medical officer. She says the experience forced hospitals to rethink patient flow.
So we have personally leased some beds with skilled nursing facilities so that if there's an influx of patients, we have a place to discharge patients to, because it's not just people coming in the front door, it's how do we get them out of the hospital to keep the flow going.
Public health experts are also working to catch the next outbreak early. At UC San Diego, researchers are leading a 5-year CDC-funded pandemic preparedness project aimed at detecting new viruses before they overwhelm hospitals. Marva Seifert is leading the study's clinical component.
So instead of just seeing when people are sick enough to go to the hospital, this program will allow us to know what's actually circulating in the community.
She says real-time data could help detect new virus strains before they spread.
So then we're better prepared when something changes, when there's a new variant or a new strain of COVID or flu that pops up.
Sharif says the data can also help hospitals predict surges.
Predictive analytics are really helpful, not just looking at the pandemic itself, but also helping us with staffing models. So we were able to staff up when we needed to in advance instead of just waiting for the storm to hit.
She says communication between hospitals and the county has also improved.
We have a better relationship, closer relationship with the county than we did before, and we know who to call, when we need something.
But even as hospitals are better prepared, the personal impact of the virus remains a challenge. Psychiatrist Dr. Alan Lee is still experiencing the effects of long COVID. Constant fatigue forced him to stop working.
When you're sick and you're tired and then you're trying to access treatment, that's hard enough. And then this is a new illness. The story is being written as we go.
Lee says the biggest problem isn't just the illness, it's the lack of recognition.
Because without awareness, people forget, and then there's no family and friend support, which these patients need. There's no funding, which is the fuel for the research and the treatment that's needed.
Until that treatment is found, Lee says he'll continue to try anything his doctor suggests to manage his symptoms. Back at Scripps Chula Vista, Dr. Juan Tovar is optimistic about the county's future emergency response.
It feels like we're more of a community now than we were previously. It feels to me like we have something special in San Diego, and we came out of this very messed up disease state, this period, and now we're doing much better for it.
Experts agree that San Diego is in a better position than it was 5 years ago, But predicting the next pandemic remains the biggest challenge. For now, hospitals and researchers are watching potential threats closely, hoping their work will give us a head start next time. Heidi de Marco, KPBS News.